Welcome to the Nutritious and Delicious podcast. I'm Bethany, and I've been in the health and wellness space for over 18 years. As a previous health nurse and now a certified holistic nutritional consultant, I help clients with their hormone health, fertility, and family health. Join us on this journey as we connect with experts from around the globe, sharing insights and personal stories along the way. So today I'm here with the amazing Pauline, so welcome.
Thank you. Thank you for that lovely introduction, Bethany. Thank you.
Yeah, so today I'm going to talk all about fertility with Pauline here. So I'm going to introduce Pauline to the show. So Pauline Barrett is a fertility nurse consultant and a certified coach. She specializes in fertility, emotional well-being, and lifestyle optimization. Pauline actually supports couples and women pursuing the solo parenthood around the world, helping them build confidence, clarity, and control as they navigate complex fertility pathways, including those facing delays in accessing treatments. So today, the podcast, this is going to be a great one. This is something that I've really wanted to have on the podcast for a really long time. It's actually called Waiting Too Long, Facing Fertility Funding and Health Obstacles. So I'm really excited because Pauline is a fertility nurse and she has the behind the scenes access and can give us a lot of information here. So my first question to you as a fertility nurse is, what are some common challenges that you've seen in couples and also single women when they've realized they've waited too long to start trying for a baby?
Thank you. It's a pleasure to be on this platform with you because raising awareness for couples and women who are taking that solo challenge is very important to bring to the forefront. And so, regards to that first question, the most common challenges, well, the first challenge is the emotional shock that they may experience. And by that, I mean women who feel they have a mix of regret for leaving it too long, uh, in a state of panic when they
Oh,
feel, what can I do now? And the final one, and the major one, is self-blame. They blame themselves for leaving it so long, for concentrating on other things in life. Um, and it's not something that they can foresee um, coming through life, because being able to conceive and have a child is female's human right and human desire.
right.
So even through life circumstances, careers come into the forefront. So women nowadays are more um, guided towards having a good, sound career before they start their families.
Yeah.
That might take a number of years, involving long-term study, climbing up that promotional ladder, and being accepted as a female in a prominent male-dominate world. There's also the finances. I know we're going to talk about that later
Mhm.
on, but ensuring that you've got enough money in the bank to support the rearing of a child or children is very important. So career comes with the financial benefits, and then the health issues play a role as well. The second challenge, I feel, that's seen in the reproductive world is the reproductive aging. This is a silent process. So even though we are getting older, we don't often feel aged, but our eggs are almost 9 months, 10 months older than we are in
Wow.
reality. We're born with the number of eggs that we have in while we're in our mother's wombs. So the numbers of eggs drop off rapidly after birth, at puberty, and then, during our early reproductive years. So we're losing a lot and we don't know it. So that part of it is silent. It's happening without us, our awareness.
Mm-hmm.
So as I said, women feel healthy, but the egg reserve and the egg quality can decline without any symptoms at all. And finally, there's a loss of trust of our own bodies. So our bodies are failing us. So, why can't I conceive? Why is it taking me this long? What is going on without embarking on investigations? So we're on that wavelength of thinking, do I have enough time? Have I left it too late? And feeling hard on themselves
Right.
for that process.
That's a lot to take in. Like, I was, as you were talking, I was kind of thinking about it, like the things that I heard you say that came up, problems in terms was like regret, blame, very career focused. Like, so you're trying to sort of like get your feet on the ground, money involved, but then
Yes,
you're sort of now playing with this time.
yes,
And obviously, we haven't evolved enough for women to be having their babies later, to start their families in their 40s or 50s, which is probably where most women are maybe more financially set up career wise.
absolutely. Yeah.
Exactly.
Mm.
So, you know, we'll go into some of these more, I think, as well. But as we're having this conversation, kind of from your experience behind the scenes, how have the health obstacles women face when starting the fertility later in life, how has it like evolved over the years?
Mm. Okay, yes, a good question as well. We're seeing more women diagnosed much later than with conditions than we would like women being discovered with polycystic ovarian um, diagnosis or the actual syndrome, or with endometriosis or intrauterine fibroids. Now, I'll just pick on endometriosis because that's a condition that many thousands and thousands of women out there have
Right.
and never seek medical attention because they put it down to, oh, it's a bad period. It's a severe period. I have heavy bleeding. It's common. Oh, they've been told in the past by the doctors that it's common,
Right.
take painkillers, take rest, take, um, a chance to sort of like resolve this situation yourself because it's common to many women.
Yeah.
However, they're not being diagnosed or investigated of how severe the endometriosis is and how it actually can affect their fertility. So the misogyny from our healthcare providers, not listening to women, it's changing slightly, I think, over the years, Bethany. Women
Yeah.
are having more stronger voices and want to be heard, want to be seen, and want to be advised and guided and taken notice of by their health providers, the GPs in the
Yeah.
UK. So we are fighting to say, look, this pain isn't normal. This pain, this bleeding, the loss of so much blood each month, which confines me to bed, is not normal. Can we look into what the cause is? So, having a diagnostic procedure done, a laparoscopy, just to see how severe the endometriosis is, an ultrasound scan to diagnose whether the woman is actually confirmed as having polycystic appearance of her ovaries, which can relate to having amenorrheic episodes where they don't have a period every month, therefore they can't time their ovulation. So these conditions that the female, even in a couple or a solo, will need to have investigations to see what their underlying issues are, how it could affect fertility in the future, well, now or in the future, and have some guidance and support moving forward.
Mm-hmm.
Um, we've got more women, as you said before, in the 30s and early 40s who have been career driven, studying, until they find that financial stability, haven't explored fertility, haven't explored trying to conceive. And also, there are women who have established themselves in a career in their life, and are unable to find the perfect match for them. So they're finding their lifelong partners at a later stage.
Yeah.
Yeah.
That's a lot. What pops up for me when I'm listening to this is there is sort of that blanket over like what's really going on. Like you said, like the general practitioner is the same here. There's not a lot of listening going on, for
Yeah.
females, unfortunately. So I think that is a commonality thing. I had the same experience, unfortunately, but I got to deal with that in my early 20s. So the thing is, what cropped up for me when you were talking about it is there something where birth control is masking these symptoms for women, and they're utilizing these birth control methods up until they want to start trying, and then now they're looking at it going, well, it was masking all those symptoms, because mostly when you go to the doctor, it's like, well, if you take this birth control, you'll have, a fake period, really, and all that kind of stuff. And it takes away those symptoms of PCOS and endometriosis. But then what happens is, as you try to come off them, your body's trying to sort of normalize itself. And then you're going without periods, you're having painful periods, and now you're having to deal with all those health issues when you wanted to get pregnant. Is this what you're seeing?
Yeah, I think you're quite right there. When women do approach their GPs for help and advice because of heavy periods, for instance, the first thing they will do is give them medical preparation called Depo-Provera,
Yeah.
which is an injection that you're familiar with. They have every month, and it suppresses. It does what it
Yeah.
does, and it suppresses the menses of a woman. So when she does then wish to think about seeking her rights to have a child, it's disrupted the whole normal reproductive system. And for endometriosis as well, they're advised to take medications that suppresses or downregulates the cycle, the actual anatomy
Right.
of the myometrium of the uterus, and prevents the excessive bleeding. But so there's more concentrated on preventing anomalies in bleeding, normal menses, rather than diagnosis and controlling the process. It's almost closing it down, and
Yeah.
there's no worry anymore. Does that make sense,
Yeah,
Bethany?
that's exactly
Yeah,
what I personally dealt with, and also clients that have come to me as well, is the suppression of
yes,
periods. And okay, well, let's get rid of the problem. Here's some medication. Here's a procedure,
absolutely.
whatever it is. And then because the goal at that time is probably not to get pregnant, but is more sort of for birth control or trying to get rid of it. But the amount of women I hear that's like, well, I don't have a period anymore. I'm not using
Mm,
um, like these methods or whatever it is. But I'm like, but then if you're wanting and talking about having children, like later in life, you're going to experience all these issues. Um, and it's a hard place to be, because maybe what I could ask you is, if women aren't wanting to sort of suppress their periods, or issues that are going on, how can they sort of, I guess,
mm,
live with what's going on and really think about their reproductive health in the later years without sort of taking those suppression drugs and everything? How are they supposed to sort of stay in that? And also, like, if they're not wanting to get pregnant yet, like if they're not on their journey where they're like, hey, I still want to, maybe in 5 years time, maybe they're thinking
mm.
about it a little bit later. Like, what would you advise them instead of like something that
Yeah.
would suppress?
It's a difficult one for me to address because we don't see women at that stage. We see them when they're then wanting to have children
Right.
in our clinical environment. But what I would say um, along those lines is, if a woman has, and we're talking about women's health here, if women's health is listened to more frequently with a positive outcome, and we can help women to understand why they're having these heavy bleeds, what's causing them, give them a diagnosis so they can manage it. And management, say, of endometriosis,
Mhm.
is one of the management is pain relief, so they can still cope to survive their daily routine. Um, Knowing when their periods are due, they can take sort of steps in improving their health during those uh, menstrual times. So, improving their diet, which is where you would come into, addressing what's healthy for them to improve their iron uptake because of excess bleeding. It shows at least to a deficiency of iron. So, what they can take healthily rather than supplements that you can get over the internet. I'm very much for healthy living, healthy lifestyles, foods that can improve their general health and well-being. With women who have got polycystic ovaries, who have the absent periods, then again, nutrition, the correct nutritional
Mhm.
plan will benefit and see the changes. Because with PCOS, there's a deficiency of insulin. So what can we do in our
Mhm.
diets to improve that?
Right.
Um, the medical preparation for women who have got polycystic ovaries is metformin, but there's also a change of diet, change of
Right.
lifestyle that can help them. So if they're being diagnosed appropriately, effectively at the right time when they are young, and when they know that their menstrual patterns and there's a change to it. If they are guided in the right way, we can look at these alternatives in
Mhm.
lifestyle. You'd agree.
Yeah.
Smoking and drinking, diet, exercise is very important, and that can keep the weight down when women have polycystic ovarian syndrome. Weight gain is one of the prominent things, side effects that we see. So yeah, there are changes that they can introduce or improvements that they can introduce into their life without also trying to conceive, but
Yeah.
making themselves as healthy as possible. So when that choice then comes and they are ready to think about parenthood, they're on the right side of preparation.
I love that you talk so much about holistic health with that. And that's exactly what I do in terms of preparation for ladies that want to eventually have children, may not be there right now, but are experiencing those hormonal imbalances. The thing is with myself, I went through that in my early 20s where no periods for 2 years, coming off birth control, wondering what's going on, figuring out that I did have
Yes.
PCOS myself, family history of endometriosis. So obviously looking out for all those signs.
Okay.
It's been a big journey for me as well, but I thankfully got that sorted out in my 20s, and I do have two children now, but I got told at the very beginning, before I even started having kids, or even was thinking about having children, like, you're not going to get pregnant, by doctors, because they're like, you're not medically ovulating or whatever it was that they were looking at. But like you said, what you mentioned, if you look at inflammation, if you look at the supplements, your iron, routine blood work, getting that done, the type of exercise, the stress, like, you
Mm,
have to factor those all in, and it is possible. I think what we're dealing with for yourself is you're kind of dealing with the later stages of ladies coming in older,
correct.
maybe haven't gone
Mm,
through that holistic process yet. And now we're starting to, like, trying to backpedal. How do I get there? But they're on such a time crunch. So, in terms of funding, let's go into that. So, what changes have you noticed recently in, like, the funding options? You were based in the UK and England,
right.
for
Yeah.
our listeners. So, how does this impact maybe couples or single women's ability to actually pursue treatment?
Right. Yes. There have been some major changes over the last 20, 25 years.
Okay.
When I first started my journey as a fertility practitioner, we were offering 3 cycles, 3 rounds of IVF in numerous numbers of health centres, health trusts. And that's dwindled down to 2 funded cycles. And now we're in a situation where it will be difficult to find a trust that will offer a funded cycle.
Wow.
It's There's an increase in restrictions for funded treatments in the UK, and more consistently offering across the regions. There's now what we call a postcode lottery. So if you're in the right postcode where the GP or the trust supports reproductive health in women's health services, then you may well be eligible for a funded cycle. And going back to a funded cycle. But there's restrictions as well, Bethany, on these
Yeah.
funding applications. You have to be of a certain age range. That's just increased to from 40 to 42 in a few NHS trusts.
Okay.
Um, you have to have no existing children in the relationship. So if you're in a second relationship or marriage and you have had a child previously, or and your new husband or partner hasn't had any children, you're not eligible for funding. If he has children in his previous relationship, um, as a couple, you're not eligible for funding. And
Thanks.
you've got to have the right postcode as well. If you have, say, live in an area that GP supports reproductive health services, then you may well be eligible. But the funding is
Right.
there, but it's almost about 2 or 3 years waiting to get to that funded cycle. So if you start off when you're 30, 38, maybe, you may have been trying for, 2, 3 years before that, then you go and seek fertility assistance, you go for tests, investigations. That could take up to 18 months to 2 years. Then
Right.
they'll put you on the waiting list. And then you're 40, 41 by the time you're eligible for a funded cycle. By that time, we talked already, you're You have aged eggs, quality is not so good. You have one round, and after that, you would have to think about self funding or sadly going down the road of childlessness.
Right. What is the cost out of pocket for um, couples or women in the UK
Mm.
per round? Do you know?
Roughly, quite similar to the Canadian and prices. If you're having a full round without any specific um, adjustments to your treatment, like genetic testing. So a basic IVF or ICSI fertility round is going to cost between sort of like £8,000 and £10,000. We have
So,
some health service providers who are self private clinics and will offer what we call affordable IVF, and that could max up to about £3,500 to £4,500. Again, one per round, and that's all the way through treatment.
what is the success rate usually for an IVF round?
Yeah, success rates again depends on the age and depends on etiology. So roughly for somebody who's under 30 or 35 and under, the success rate may be 35% to 55% per clinical pregnancy and 35 to 45 per live rate, birth rate. So when we talk about these stats, and I give our patients the statistics, I say numbers are numbers. There's so many hurdles on your journey
Yeah.
that it's hard to say you, as somebody who's 35 and under, have a 45% chance of a pregnancy, almost one in two, one in three chances of having a pregnancy or a live birth. But what if they don't stimulate well? What if they don't get eggs that are good quality and then don't fertilize and don't have good quality embryo to put
Right.
back? So everything, every stage is another hurdle before they get to that final statistic.
That I could imagine after 35, that rate goes down quite a bit.
It does.
Yeah.
It does.
And I could imagine how disappointing it would be for failed success
Yeah.
rates, you know,
Mm.
especially when there's time involved and also money and funding involved, as well as you said, like the postal code, if you live in the right area, like things like that. There's so many things on that journey. Just for viewers at home, I just have a couple of statistics here in terms of Canadian and American. So in Canada, this is where I am. The cost of fertility treatments varies by province, and public funding is limited and inconsistent across Canada. Some provinces offer partial coverage for treatments like IVF,
Mhm.
but many couples actually face out of pocket expenses, often ranging from $7,000 Canadian to $15,000 Canadian or more per cycle.
Mm.
That's quite a lot. And I know a lot of people who have already done it had a few kids and it's cost them a good 50 grand. And that was out of pocket, right? So that's quite expensive for people. And unfortunately, it's kind of been more people that have been privileged with that money, but it's taken them years and years to get pregnant, unfortunately. A lot of clients too are in the States, and I hear quite a lot of hardship there as well. So for the Americans, IVF treatments in the US typically cost between 12,000 US dollars to $15,000 US per cycle without insurance. And many couples face significant financial barriers without compensation, insurance plans, and employee benefits. And some states actually mandate insurance coverage for fertility treatments.
Mm.
So it's quite hard listening to that because there's so many people out there that, like you said, do you want to be childless? And if you have that dream that you want to be a mom or a dad, it's such a hard thing to go through, and tell somebody that, or face that.
Mm.
Can you share sort of insights about how like emotional and financial stress like affect couples differently when fertility becomes like an urgent concern? Because I've heard you talk about it like there's now urgency.
Yeah, yeah, yes. I mean, it really is to sad to hear. that what you state about the USA and Canada is very similar around the world as well. I don't have
Yeah.
figures on that, but there are more couples who are having to finance their own treatment
Hmm.
in today's world. The financial strain can influence the decisions they make, and suddenly some couples stop altogether because the treatment becomes so overwhelming.
Yeah.
Treatment costs becomes overwhelming, shall I say? Um, right. When it comes to urgency, though, it's to you and I and another couple, another individual. The urgency is different. Now, obviously, if you're younger, you have got a little bit more time to make that decision to raise the cost that it will entail to have a fertility treatment. But when fertility itself becomes urgent, the emotional and the financial stress is at the top of their concern, very top of the concern. And that causes, I feel, and I've seen with couples that I've had through my coaching session, that it's almost like we have to work harder to get the money so that we can have our treatment. Um, and one couple may feel the stress more than the other. And it could be the male partner who knows that he has to work extra hard to get the money to finance to meet his and his wife's dream and desire to have a
Right.
child. Um, they're making decisions, I think, out of fear, the fear of being childless, and not being recognized in society as the normal picture. You've heard the term 2.4 children, family, two
Yeah.
parents, two children. They feel that they have to be in that inclusivity to be seen as a normal couple, a normal family. And rather than to be accused of not wanting to have children, where in the background they have been struggling to conceive for that time. So
Wow.
they're hiding they're hiding their shame, um, and they have this enormous secrecy to go through life.
Hmm.
Um, there's a strain on communication between them, and there's differences that they'll expose as coping styles. And one partner could just go into a silent mode, which may not seem supportive to the other couple, the other individual. And they just have this focus, which is understandable, that this is a one stop shot. After this, where do we go? What
Right.
happens to us? Who do we then become? So it's the emotional effect of struggling with infertility adds to the financial stress adds to the emotional stress, and knowing where to go. So the cost of waiting is and can be devastating as well. Looking at, well, once we do get on I call it the roller coaster, Bethany, because once you get on a fertility treatment, it is a roller coaster. You have to
Hmm.
negotiate time off from work. You've got to negotiate your absentees when your family occasions are happening. You make yourself absent because it's difficult to face other people who are celebrating, whether it's a new birth or um, Christmas and Thanksgivings in the USA. So family gatherings include children, include that discussion
Hmm.
of when are we going to hear the patter of tiny feet. So the financial strain and the emotional strain go together. They very much go together. And even though couples do try and separate them, it is difficult because you can't, without the funds, you can't have treatment. And then
Right.
the desire, urgency to have a child, it comes further in the distance.
It's a very sensitive topic, and I've heard a lot of people through chats, through talking to them. What I see for the women is very, very hard to deal emotionally, with the, like you said, the partner, first of all, with the silence. Maybe they're going a
Mm-hmm.
different direction. They're stressed out. They're trying to provide. They're trying to be a man in that aspect. But I hear a
Mm-hmm.
lot from the women that it's the family occasion, the celebrations, which you talk of, and feeling like everybody else is getting pregnant or celebrating and having that life. But what you also mentioned is that there's this hiding, the shame, the secrecy, And we know that those aspects keep people stuck emotionally. Um, we hear when women sort of, it's hard because when women hear this, they hate this. It's like, just relax, it'll happen, you'll get pregnant, like all these
Yeah,
things. Um,
definitely.
it's like when you hear about that and people go in the adoption route and then they all of a sudden get pregnant because it's like
Mm.
they were inviting that child, that love in. What is sort of some advice you would say to couples that are sort of emotionally distancing themselves maybe from family or friends or other people that have children? Because I also know that them staying away on the emotional front wouldn't be helping either, because the secrecy and the shame and everything, and it keeps you in this sort of bubble. Would you not recommend that they reach out or talk to family or friends or something about their journey, or somebody like yourself in coaching? Because this, like you said, is such a big factor in getting pregnant. It's not just about finances, there's a huge emotional component.
Yeah. Yeah, you're absolutely right. And that phrase, yeah, don't stress, it will happen, comes up so many times. And this is something that a lot of couples will say to me, I'm just, don't want to hear that anymore. There is the physical side of not being able to conceive. If a female doesn't have fallopian tubes, she will never conceive naturally.
Yeah.
If she has severe endometriosis, there may be a delay on achieving a pregnancy with a viable, good quality egg, because her ovaries could be damaged with the severity of endometriosis. And with polycystic ovaries, it will take longer to conceive because the brain doesn't know which follicle to wake up to ovulate to find sperm.
Mm.
And then we've got the male side. If there is severe male infertility, whether it's loss of the quantity of normal morphology, so formed of sperm, sorry,
Yeah.
or a low count. So if you've got few sperm and they're not shaped the right way, they will never get to the egg at the right time of ovulation.
Right.
So there's a physical obstructions in fertility. But if you take away those and concentrate on the emotional side, it can be helpful if you go through a coaching program like myself.
Yeah.
And my program is a 9-month program, which, in normal terms, if you are seeking assistance in trying to conceive, you will always be told, oh, try for a year, try for 2 years, and you should conceive. So my coaching program is now extended from 6 months to 9 months. So I've got two options.
Hmm.
Depends on how far they're on to their journey, Bethany. But coaching is, I think, a vital support to couples who are trying to conceive, because it helps them with those emotional barriers that they are facing themselves.
Right.
We've talked already about talking openly to other individuals. Couples, I think women more than men, they're quite reluctant to
Yeah.
embark on these programs. I usually coach women on their own. Their partners are invited, but women will find that they prepare barriers as a safety. Instead of going to a family event where there's lots of children, summer things, Christmas, baby showers, they will take themselves away from that situation purely because of the fear, the worry, um, the guilt of not being able to answer, when are you trying for children? Why have you not got children yet? So to not face those conversations, they remove themselves from those environments. It's a safety barrier.
Right.
So in my coaching program, we work through tools of how to face those conversations, prepare themselves with the tools that I introduced into my program, um, and situations, and uh, almost make them face it in
Yeah.
a way that's best for them and comfortable, so they are prepared to have those conversations with confidence, and then they're in control of that conversation. If the conversation subject is, oh, I'd rather not talk about it right now, I give them the confidence to have that dialogue with them, with anybody else. Or if they're addressing, why have you not had children, you're being selfish and not trying to bring grandmother her
Yeah.
grandchild.
Guilt.
There's that guilt there, isn't there?
Yeah.
And again, it's finding a way that's safe for them to have that conversation. So we work through some tools. We look at I call it my road mapping. So we're rerouting the pathway.
I love
Instead
it.
of having one direction, we work, which is the best for them, which direction they can go with.
I love that.
And
For the couples you've mentioned, what you're doing is you're giving them more control, setting
absolutely,
boundaries. There's a good dialogue you're helping them with, and emotional safety. So all of those things are true. They're really helpful. I think somebody that is struggling. Um, what do you believe in coaching is important for the single women who want children, especially when facing fertility challenges? So, how is like that's for the couple, and the woman's probably giving that information as well to her partner. What about the woman doing this alone?
the woman who's doing this alone, actually, because she's already made that decision to be a solo parenthood, she's taken control. So you can
Mhm.
imagine the strength that she's already got by deciding, I will not have to wait for a male partner. I can take this road. I have the ability to stand with strength to um, see what my future lies and what I can provide for a child coming into the world, a child or children. So she's already gained that strength, that control, and my support is how she can manage to maintain it all the way through. And as her coach, I will be the one beside her through her journey. And being in the fertility world myself, I know exactly what experiences she will come up against. I think that's a benefit of having myself as a coach. Not only do I know about coaching and the needs of it, I've been in the reproductive world treatments. I can guide them as to which is the most optimizing treatment for them, what treatments they don't need to be facing. We have in the UK some treatments that we could refer to as add-ons, biopsies of the embryos,
Mhm.
um, assessments of endometrial lining. It's not needed by everybody. These are add-ons that cost an enormous amount and
Mhm.
increase the financial stresses of that. They're vitally important to consider for some, a small minority of couples or individuals going through treatment, but not everybody. So I can guide them through the add-ons to avoid. We can guide them through the supplements that they don't need to purchase online. That can be quite expensive and
Mhm.
not effective to their outcome. So as a single woman, first of all, she's made the choice. She's got the strength. She's got a control. And I find that my women who are on the solo parenthood journey, they've established a lifestyle that they are happy with. They've achieved their career. Um, they have enough finances to finance the treatment cycles, possibly, and make ensure that the home is the best it can be. We have a young girl she's quite popular on the social media front, and she decided, I think she was 25. She said she bought a house. She needed, she wanted a family, but she just did not find the right partner,
Mhm.
no matter how many relationships she went in. And she decided to make that choice to have donor sperm to achieve her pregnancy. And
Wow.
she did really well. She's had a little boy, he's probably about 4 or 5 now, and has embryos left over. So she's going down that parental journey again. She's had positive feedback, as I say, being on social media, and she's had negative feedback.
Mhm. Yeah.
So she's done what's best for her.
Right.
And still to this point, she has not got or found a relationship or a partner. And she's quite happy. Her child has got everything she feels that child needs. So going through the solo parenthood route, you'll have myself as your coach. You'll have the support. They tend to have a small network of confidential or
Mhm.
confidants that they will speak with, especially when they're going through treatment. They may need someone to escort them to
Mhm.
and from their procedure and to look after them. So they'll protect themselves. I find as well the women who are going through solo parenthood have a great deal of support from their families, their friends, their parents or parents on this journey. So to make that decision is kind of, right, I'm going to have a child. I haven't got a partner, but this is what I want to do.
Right.
It's easier to accept. She's outlined her plan for parenthood, and the family accept it in the majority of cases, and those who don't, she knows, she's known how to approach, who to include in her journey. So
Hmm.
the parenthood, solo parenthood, are more prepared for the
Yeah, that's
journey.
what I was gonna say. It sounds like they're more prepared. They already have their mind made up.
Absolutely.
They have the support. Um, it's I think probably because they're not in a couplehood in a sense, going to parties and events. People aren't asking them these questions probably
Mm,
because they don't
mm,
see that. And then it again, like you always get negative out of, whenever
yeah,
anybody does anything. That's always it. But I think once you've sort of made that decision and it's about you, I would imagine that probably a lot of the women that are coupled up are getting those questions because they got married or whatever it is. And the next step is, well, when is the baby and
mm,
why aren't you having children? And so I could imagine there's probably a different set of questions for both. I
mm.
love that you're helping all these couples. I had one more sort of question because we talked about the couples getting the counseling with you and the coaching and the singles. What about the couples that already maybe have children, or women that are having children, like they've had children earlier, then they want children later, or they've maybe had children with other people and then they're having children later in life? What are you seeing with that dynamic?
Yeah, it's on the increase actually, Bethany. And as I said before, the second relationship, second partners, they are wanting to have a child between them to consolidate their new relationship. And there's a high number actually who are coming through for what we call coming through with secondary infertility. So a previous child and now wanting to have or extend their family. Um, and that's a twofold actually, because I think not many of my clients are through secondary for infertility. Most of them are primary, first time trying to conceive. But in the clinical environment at work, where I see patients coming through for treatment, there's almost a pressure for them to prove the significance of their relationship, the unity of their relationship, to
Mhm.
try and conceive a child together. Um, and deep down, I wonder how much it does influence them as a couple, adding the strain, the financial
Right,
need to have a child because we're now together as a unit.
right.
We
Is
have
this
men who have had previous vasectomies, for instance.
okay, yeah.
Um, as children have grown up in their early teens or late teens and now met a new partner, married, and desires to have a child. Male factor because his
Yeah.
vasectomy is there, so it's surgical procedures for him to undertake. Um,
Are you seeing that more often with the
yeah.
second sort of marriages? It's that they may have it's more so in a male aspect of the vasectomy, or is it the age of the couple together in terms of
Mm,
now trying to have children later or even with a different partner?
mm. Yeah, the combination of all three, actually.
Yeah.
We've had male factors, if I like, vasectomies. So previous vasectomies. We've had women who have had tubal ligations, so been sterilized
Oh, wow.
because they've had children, met a new partner, and now undergoing IVF because the
Wow.
tubal transportation is gone because the tubes have
Right.
been nipped in sterilization. We've had men who were previously married, older, and new partners who are now ready to have a child themselves. So there's, I mean, we had a couple who um, he had a vasectomy before, had a reversal. His reversal sperm check was zero, so he had azospermia. So the sperm, the actual procedure worked because it is to in make him sterile, and he is
Right.
now sterile. So the way forward for them to have a child together would be to use donor sperm. Now,
Right.
is that a togetherness or is it a desire to have a child?
Right.
So this and again, the decision can be taken in haste to go through treatment um, without the long-term implications of what it actually means. So for the gentleman, for instance, the only way his partner will have a baby is through anonymous donor
Right.
sperm.
Right.
How will it, right now, yep, they may agree, but what will he feel and think in the future? And
Right.
his relationship to this child, um, and her relationship to, yeah, she's achieved a
Yeah.
pregnancy, but it's not the desired outcome. So
Right.
the coaching will help them to reach a level of understanding of embarking on a treatment. That is it necessary? Is it ideal? Is it right for now, or will it be right for the future?
Right.
So, when I said before that making a decision can be in haste, can be in urgency, which is not given thought or implications of the outcome down the line when this
Right.
child is 5, 10, 15. We've got to really understand fertility treatment, where it's going to take us, and what how can we handle it. Um, Early coaching is important rather
Yeah.
than, okay, you've had a vasectomy, let's just go and get an IVF treatment cycle, see what we can do. The early coaching will be vitally important for that couple
Right.
to address what they are going to come up against as barriers, and implications for the future, not just for themselves, but any child born from conception.
Right.
Is always
That's
important.
that's so complex in a sense because like you said, there's so many different dynamics. So there's so many we're not sort of back in the 1950s where everybody
No.
sort of got married to the first person, they met and they had
Yes.
kids in their 20s and the wife stayed home and didn't have a career. Like it's so different now. Like women are doing it on their own. There's second, third relationships, marriages,
Mm,
vasectomies, tubal ligations, people had kids
yeah.
earlier. Like, so that's where I think the coaching comes into play with yourself because there's so many complexities basically, really, like with what's going on, because it's not just a one and done for everybody. There's so many different factors involved. Um, and just finances, like you talked about sort of the emotions and couples, going through those boundaries, the dialogue, the emotional safety, feeling like you have control in your life. I think this is a great place to connect with Pauline. So thank you so much for coming on the show today, Pauline. Where can our listeners find you?
Right. Well, yes, I am based in the UK, but a number of my clients have been international. So I have a coaching service which is online and usually in the evening. So it's a comfort of your own home. You can find me on fertility-health.info. That's my website. We have a direct email address, which is support@fertility-health.info. And we're on Instagram as well, and that's fertilityhealth.support. I have got a few books, a number of books on Amazon, and I think Bethany will share that link direct with you. And it covers a wide range of emotional feelings, aspects that you may come across that will hopefully help you through your journey. And just to bear in one more thing is fertility coaching doesn't have to be a long-term thing. If you just reach out to me for consultation, advice, and guidance, I'm there for that. Over 30 years of experience. So I know everything that you may well be experiencing right now. And with the support of Bethany and her nutritional advice and holistic care, it's taking the right steps for you, which I think is important
I love that.
wherever you are in your journey. Yes.
Yeah, I love that. Pauline has so much experience, and I'm going to add all of those links to our show notes. So make sure you go and check out her book on Amazon and check out her website. Like follow her on Instagram. LinkedIn is going to be in there as well for you.
Yes.
So I have one last fun question for you that we usually ask our guests. So, what is one thing for you that's been on a bucket list that maybe you've wanted to do, or maybe you've already done?
Okay. Well, I had to give this some thought actually. And I think the one thing I'd like to do is sail down the Nile.
Wow, that's a big one.
Yeah.
I love
Yeah.
that. You'd see some
And
amazing crocodiles.
yes. So yeah, I think that's got to be on my bucket list. It's shouldn't be too far in the future, but you know, I'm a very great fan of Agatha Christie's, and that Death on the Nile is just to sail down the Nile will be amazing.
Yeah.
Yes,
That's a great
for
one. I
sure.
love it. I love anything sort
Mm,
of like adventure and travel.
yes.
So thank you so much for coming on and all your expertise. Stay tuned for our next episode, everybody. And don't forget to like and subscribe so you never miss a show. In good health.